So you can go online and you can go to Keto Mojo, and I'm not getting any financial backing for doing this. I just have found this to be a great way to monitor myself. So the kit comes with a device to poke you. Now, the needle it goes into this poker device, and you cock it by pulling this back, and you pull the tip off, which releases the needle. And then, looks like maybe I bent it a little bit. Then you put the top on, and you can set it here for, if you have really thin skin, you can go down to a 1, or you can go all the way up to a 5. Well, I have a lot of calluses in my hands because I use them a lot, so I use the 5. Okay, so you get that loaded, and then there's 2 types of strips. The blue strip are the ketone strips, and the brown strips are the glucose strips. You take them and you put the colored side up. See, it's white on the bottom, colored side up, and you put, this thing goes in the little slot. So when you push it in the slot, it automatically lights up and it recognizes, okay, it's going to be testing ketones. So now we want to get some blood, so we take our poker and we put it up against the finger, and you push the button, and voila. I didn't even feel it. You feel the blood come out. Okay, you take this and you touch it, and it sucks the blood up into that little tube, and you'll see it starts counting. And it takes 9 seconds to give us the ketone reading. And I have 0.4. So I think any level of ketones is a degree of ketosis. Now they want it to be 0.5 to be like in weight loss mode. Okay, so it automatically records that. Then you take the other, the glucose strip, and again, brown side up, white side down, goes in the little slot, and it recognizes, oh, now we're going to do glucose. So I may want to express a little bit more blood, or if I'm still not, I guess I can squeeze a little bit more blood out. Okay, so you need about that much. And this is absolutely painless. I don't feel anything. So you touch it there, it sucks it up in that little strip, and it reads, and my fasting glucose is 79. So it then syncs with my phone, with my app on the phone, and I'm going to put this back to me. Thank you.
Sure.
It syncs with the app on the phone, and it calculates this, what's called the glucose ketone index. Now, I have another sheet here that I'm going to share with you that talks about glucose ketone index. Okay? So this is an index that was developed by a guy named Thomas Seyfried, and he's the world's leading researcher on the metabolic theory of cancer. And basically he is studying, following up on the work of a guy named Otto Warburg, who was a buddy of Einstein, who got the Nobel Prize for his work with finding that cancer, for the most part, can only burn glucose. And so strategies that reduce glucose and increase ketones have been researched for, well, Warburg got his Nobel Prize in 1931, so we're almost 100 years of research on the impact of glucose on cancer. So the Keto Mojo device, this device that I'm talking about, on the app, it calculates this, what's called a glucose ketone index. So if your index is above 9, you're not in ketosis. If you're in 6 to 9, you're in the low level. If you're 3 to 6, you're moderate. 1 to 3, you're in a high level. And if you're less than 1, you're the highest therapeutic level. And like it says, it's very difficult to achieve this without a doctor's supervision. You have to almost like be taking ketones and doing significant fasting and really high-fat, low-carb diet. But for people who are looking to reduce weight, well, you get good weight loss in the 6 to 9 level. If you really are struggling with type 2 diabetes, obesity, these things, this is going to be your target. And this is for people with things like cancer, epilepsy, Alzheimer's, Parkinson's, traumatic brain imagery, inflammatory conditions. So for those people, the sun's coming out. So I think the importance of measuring ketones is to make sure you're getting into ketosis, especially if you're not getting the results you're looking for. But the typical results that people get, they start to lose weight, their blood pressure goes down, and of course the public service announcement here, the disclaimer is that I'm not offering medical advice, you're not becoming my patient. These are for information uses only. And certainly if you have these more significant conditions, like I just said, like epilepsy, cancer, Alzheimer's, Parkinson's, etc., you want to be working with your doctor and tell your doctor you're doing this, because a lot of those things, especially things that are like psychoses, like depression, anxiety, schizophrenia, bipolar, those things, often people are medicated, and as you deal with the root cause of your problem, a lot of times your medications need to be adjusted, hopefully reduced, maybe getting rid of altogether. Along that line, there's a great podcast called Metabolic Mind. So you can just go to where you get your podcasts and put in Metabolic Mind. And there's a whole group of doctors and researchers who are following this phenomenon and realizing that a lot of the things that we thought were neurodegenerative or psychotic were actually brain energy issues. There's a great book called Brain Energy by Christopher Palmer that I would really suggest